Cardiac looping and cardiac spiralation.
Yeah.
Spiralation is just for the aorta and the pulmonary artery doc.
Yeah, so it's a truncus
Just if there's a
spiralation.
problem.
I'm sorry, continue.
So if there's a problem in the spiraling of the aorta and the pulmonary artery, then they will have truncus arteriosus or transposition of the greater vessels, not truncus, just the transposition. And looping problems, then probably the septations are not formed properly, or maybe the chambers are not correct.
Yep, that is correct. Okay, what about you said about the looping? Not yet. Can you tell me more about the looping process?
If there is a problem in the looping, then maybe dextrocardia or...
Okay, and why this might happen?
No idea. Actually, I have no idea about the looping, how the looping and all happens, Doc. But I remember you were discussing it with Sushant, and that time I thought I'll ask Sushant after the class, and I forgot.
Okay, so it's Sushant's fault.
Sushant's fault, yeah.
Good. Well, look, basically, look, you have this primary cardiac tube, okay? So these are your atrium, and these up here are your ventricle. But normally you know that your atrium are above your ventricles, yeah? So look what happens.
Yeah.
The atrium grows and it loops. See, it's going up, 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 up. So the atrium went up, okay? That's cardiac looping. So that's the process of cardiac looping, and it's mediated by the dynein arm, okay?
Okay.
So moving on, we have something called the septation, and it's defective in case of Cartaginer syndrome, which make the heart be on the right. Can you tell me other symptoms of Cartaginer syndrome, please?
Cartaginer's anosmia, Doc, and aspermia.
What else?
No, motility.
They have sperms, but they are paralyzed. They cannot move.
Azoospermia.
Here's the thing. Their sperms exist. They
motility.
do have sperms, but basically because of the dysfunction of the dynein arm, the tail cannot move.
Yeah.
The tail is paralyzed. So if you do IVF, which is in vitro fertilization, and you take the sperm directly from the testicles and you inject them directly into the oocyte, it's possible to get the lady pregnant. Okay.
Pregnant, yeah. Yeah, Doc.
Why in the ladies they have increased risk of ectopic pregnancy with Cartaginer
because
syndrome?
the fallopian tube cilia are also not working.
Excellent. So they get ectopics, yeah? Good. So septations of the chambers. Can you tell me please about atrial septation? I know that it's a long process. I just want two things from you.
Yeah, just briefly.
Yeah. So can you tell me just two things? What is when do we get an ASD and when we get a patent foraminovalle?
So ASD when there's still a hole left, Doc. The not complete formation of the septum. And patent foramen ovale is after the birth. That foramen ovale is supposed to close because of the resistance, high resistance in the left atrium.
Okay.
It's supposed to push the secondary secondum. What do you call that? Septum secundum against the septum primum, but that is able to close, and that's not fusing. Fusion is not happening, so that's why patent foramen ovale.
So the patent foraminovalle, it's a fusion problem, while ASD is one of the primary septum, like either septum primum or septum secundum is missing, correct?
Yeah, Doc. Yeah.
Okay, good. As simple as that. So patent foraminovalle, just no fusion. That's it. And ASD, the whole septum is not existing, okay?
Yeah.
Either septum primum or septum secundum, or both.
Septum secundum.
So, speaking about the ventricular septation, we know that we have basically a septum created between the aorta and the pulmonary trunk. If this septum does not occur, this aortopulmonary septum does not occur, which pathology the patient will have?
Truncus arteriosus.
Excellent. And if they form the septum, but they are unable to spiral, what they will have?
Transposition of the greater vessels.
Excellent job. Yes, absolutely correct. So if someone has basically, let's say that aortic, if somebody has a truncus arteriosus, patent truncus arteriosus, you must know that they also will have a concomitant VSD. Yeah. Why?
Concomitant Vsd, yeah.
Just
Because they
imagine.
have to have this shunt.
What they don't, it's not about that, but basically, you know that your membranous portion of your intraventricular septum is actually made with the help of the, basically this septum between the aorta and the pulmonary trunk. Yeah, the aortopulmonary septum. So,
Yeah.
if you take a look here, you can see in the patent truncus arteriosum, you also have absence of the formation of the membranous portion of the intraventricular foramen, intraventricular septum, which lead to a concomitant VSD. Make sense?
Perfect.
Okay.
Perfect.
Next. So, the next thing here we have is, what form your mitral valve? From which embryological structure?
Mitral valve, endocardial cushion defects.
Excellent. What about your aortic?
Endocardial cushions.
Basically all of them. Yes?
Yeah, all the valves from the...
Okay, good. So I hope you memorize the aortic arch derivatives. I know they are a lot, but you must memorize them, sadly.
Yeah.
So the first aortic arch, can you tell me what it gives?
It gives the maxillary artery, doc.
What about the third one?
Third one is, second is common carotid. Third one, one second, doc. Second is stapedius artery, stapedial artery. Third is the common carotid and the proximal part of the internal carotid.
Okay. So I have one more question regarding the fetal circulation. Can you tell me, please, in the fetal circulation, which area is considered to have the lowest amount of O2? Is it the umbilical arteries or the umbilical veins?
Lowest amount of O2, umbilical arteries, doc.
Yes. And how many umbilical arteries do you have?
2.
How many umbilical vein?
1.
Okay. And the umbilical cord cross section. Which one of these three structures will be collapsed? I mean 2 umbilical arteries and 1 vein. Which one will be collapsed?
I think the vein is collapsed off.
Yes.
Arteries have still open.
Exactly.
Eyes.
Why?
Those are the eyes and...
Why? Because vein do not have internal and external elastic lamina and does not have a well-developed muscular layer. That's why it collapses. Yeah?
Okay. Just for the umbilical, doc, or any vein?
No, any vein, all of the body.
Any vein don't have the internal and external?
Elastic lamina. Which make it more easy for it to collapse. Yeah?
Okay.
Good. So one more thing. Here we have something called the Alentoric Duct. What is its function?
To take the urine, uricus is that one. Urine is for Alentoric Duct.
So what did it form after birth?
Alentoric Duct degenerates, doc.
Okay, and becomes which ligament?
Median.
Yes, median.
Umbilical
ligament. Excellent.
Ligament.
Good. If you take a look at an umbilical cord and then instead of 3 vessels you see 2, what does it mean?
Instead of 3 vessels we see only 2.
Something like this. Down syndrome.
So one Down syndrome?
Yep, this is Down syndrome or any trisomy can have that, okay? They only have 1 artery instead of 2 arteries, okay? It's highly characteristic of
Why is that, though?
I have no idea, but for the USMLE you have to know that. It's one of the markers, like if the child is born, immediately after birth, they cut the umbilical cord and they must examine it, look inside of it. So if they see only 2 vessels, they should run further tests to make sure that this patient does not have Down syndrome. Okay?
Okay.
So next, we have okay, we have three shunts inside of our fetus circulation. What are the three shunts you know?
One is foramen ovale, doc. The other one is ductus arteriosus. The other one is ductus venosus.
Excellent. And can you tell me, please, from the inferior vena cava, inside of the heart, does the blood go to the patent foramen ovale or to the right ventricle and to the pulmonary trunk?
Through the patent foramen ovale, doc.
Yeah, it's
from the superior vena cava into the tricuspid valve, but for this inferior vena cava into the patent foramen ovale.
Excellent job. Okay, so what closes the ductus arteriosus?
What closes the ductus arteriosus? Prostaglandins keep them open. So NSAIDs keep them, indomethacin keeps them closed.
Yeah, that's true, but I'm speaking like normally after birth, without your intervention.
Oh, with the left atric pressure because of the lungs, doc. Decreased resistance in the lungs causes more blood from there to there, shunting, and then that's why that causes the closure.
Okay. So, yeah, and also decreased prostaglandin synthesis, yeah, from the placenta.
Yeah, from the placenta, decreased prostaglandins.
Yeah. And one more thing, what is the posterior most chamber of the heart?
Posterior, left atrium, doc.
Okay, and if that is enlarged, it will compress what?
Yeah, it compresses the esophagus, so causes dysphagia. Sometimes, rarely, it even compresses the trachea, causing the dyspnea when it's very big. Or even compresses the sympathetic chain also.
Well, what exactly?
Sometimes.
Well, there is a nerve that they can compress.
Recurrent laryngeal nerve.
Okay, and that will lead to?
Hoarseness.
Excellent. And if I cut if I cut both of them, the recurrent laryngeal nerve, what happened to the patient?
Both the recurrent laryngeal nerve will cause vocal cord paralysis, doc. And vocal cord paralysis will have respiratory.
Yeah, that's true, but they will also become a mute. Yeah, mute.
Yeah, mute also, and also some respiratory depression, doc, something like that. Not able to breathe.
They can have this wheezing and this not wheezing. How do you say that? Stridor. Yeah. So when they take a breath in, because they are paralyzed, they cannot normally take it in. So it will be like yeah. Okay. So they love this. Someone stabbed at his sternum. Which chamber of the heart will be injured?
At the sternum, doc. Lower border of the sternum. You're asking?
Again?
Where are they stabbing, doc?
Sternum. Lower sternum.
Sternum, nothing. Lower sternum, then maybe the right atrium, doc. No, upward. Yeah, the right atrium, doc.
No. If they tell you the sternum, always it's the right ventricle. Okay? Take a look here. Take a look here. So, can you see the sternum here?
Yeah, doc, yeah.
So, immediately in front of it, there is the right ventricle. Right atrium is behind it, actually. It's far away. You have to cut through this and be... Okay, it's far away. So, it's the right ventricle. But if they tell you that he was hidden at the apex of the heart, you say the left ventricle. Okay?
Left ventricle, yeah.
Please be careful. If they tell you that do you know where is located the apex of the heart?
The fifth, at the in between the axillary and the middle clavicular, mid clavicular and the axillary, at the fifth intercostal space, doc.
It's fifth intercostal space. This is absolutely correct. But where exactly?
In between the mid clavicular and the at the mid. So 2 centimeters medial to the mid clavicular line.
Excellent. Yes. Why this is super important?
Because there will be displacement of the apex whenever there is dilatation of the left ventricle.
That's true, but they will give you a question about somebody getting a stab at the midclavicular line, and they will tell you what was hidden, what did you hit, and there will be answers like left ventricle, right ventricle, and all of that. So you will be looking at this and you will see, okay, it's midclavicular line and he was hidden with a knife, and they will tell you it was laterally located, this knife. Well, its tip was going laterally, basically.
Oh, okay. So then the lung.
Yeah, the lung. That's the point. So if you think that's why you should know exactly where is the point of the apex is located. Otherwise, you will get the question wrong. Okay?
Oh, nice.
Good. Did Sunshine tell you that?
Yeah, he just told me that.
I'm really proud of him. So, pericardium. So, speaking about the pericardium, can you tell me exactly where is the pericardial cavity located?
In between the lungs, doc.
Pericardial cavity.
Oh, cavity you're asking. Okay. So, in between the visceral pericardium and the parietal pericardium.
Yes. Okay, good. And if someone has a tamponade...
I thought you were asking me where is the pericardium actually located.
Oh,
so
no.
In between the lungs. I know it was stupid, yeah.
By the way, one more question. If somebody gets stabbed on his sternum, but really upward, which organ do you hit?
Upward, maybe the thymus, thyroid.
Yes, thymus.
No, all of those are behind. Just the thyroid, I guess, too.
The thymus. This
thymus only?
Yep. Take a look. Upper sternum, you hit the thymus. Okay?
Okay, doc.
Super high yield concept. Okay, good.
Okay.
Next thing, so I want to ask you about what is the most common coronary artery to be occluded?
Right coronary artery, no.
No.
LAD. Oh my God,
yes.
LAD. Yeah.
LAD, the maker of the widows. You know? Okay.
Yeah.
Good. Which chamber is supplied by the LAD?
Left anterior descending artery is the left ventricle, doc.
Okay, mainly the left ventricle, anterior portion of the interventricular septum as well. Okay.
Yeah.
Well, these will speak about more deeply when we discuss the ECGs, which is a portion of the rapid review thing. But for now, I just want to speak a little bit with you about the stroke volume. What increases your stroke volume? What decreases your stroke? Well, start with the stuff that increase the stroke volume. And tell me, what does it mean, stroke volume?
Stroke volume is just the volume that you push out of the heart after a contraction, though.
How many beats?
So, how many?
How many beats this is stroke volume?
75 beats. So.
No, it's 1. Stroke volume is for 1. Cardiac output is multiplied by the heart rate. Yes? So when we say the stroke volume is how much blood was pushed out from the left ventricle per 1 beat only. Okay?
Okay. I don't know. 1 second though. Okay. So he's okay. Yeah, doc.
Okay, good. So what increases your stroke volume?
No. What increases the stroke volume is the heart rate increasing, doc. But specifically, if you're talking, then the contractility of the heart rate, if the contractility increases, the stroke volume increases. And more volume coming inside also will increase the stroke volume. And if there's any obstruction after it, so afterload, if it's high, then the stroke volume is low because it has to push against it.
Okay, good. So can you tell me, please, in case of, that's a trick question, in case of septic shock, what will happen to the cardiac output?
In case of what, doc?
Septic shock.
Septic shock. Cardiac output is increased, doc.
Excellent. Good. Why?
Trying septic shock. Because It produces more blood to go and clear the sepsis.
Look, in septic shock, we have what causes the septic shock? The lipopolysaccharide, yes?
Yeah,
So
yeah, though.
this lipopolysaccharide will go and work on the smooth muscles, correct? When it works on the smooth muscles, it will lead to release of a lot of nitric oxide. Look here. So bacterial lipopolysaccharide activate the nitric oxide synthetase, which will convert L-arginine to nitric oxide, yes?
Yeah.
A lot of nitric oxide will increase the cyclic GMP, which will lead to activation of the MLC phosphatase, leading to muscle relaxation, correct?
Yeah, yeah, though.
That will lead to massive vasodilatation or constriction.
Dilatation.
Excellent. When we have massive vasodilatation, what is going to happen to your systemic vascular
Heart
resistance?
rate. Resistance will go down, doc.
It will go down. So what will you will have reflex what?
Tachycardia.
And increase in the contractility. Excellent job. Yes?
Yeah.
Makes sense?
Okay. Awesome, doc.
So
yeah.
when you take a look here, when they write about distributive shock, septic shock, cardiac output increased, systemic vascular resistance decreased. Okay?
Decreased. Yeah, doc.
That's a really important concept to master. So that's how I'm going to explain physiology for you. We'll speak about something from here, but mainly pathology, because that's what's important for you.
Awesome, doc. Awesome.
So yeah, I think that's it for today. And tomorrow we'll meet at the same time. Yes?